In the interest of pretending I'm a pharmacist, I'm going to get started on time. So welcome everybody to the 2022 State of the College. I'm going to do something a little different this year. Normally I've focused mostly on the last 12 months. You may not realize this, but it's past my 5th year in the role as Dean. I got here in 2016. I have to admit, with COVID, it doesn't feel like it. It feels like I've been here about 3 years, because I just erased the last 2 years as much as humanly possible. But it's been 5. We're about to start my summative review and entertain the possibility of me renewing for another 6-year term. So I thought I would use today's talk to mostly focus on what's happened in the last 5 years, positive and negative. Give you some sense of where I think we have been and have gone and are going to go. And I'm also going to tie into the strategic plan as we go through to talk about where we collectively plan to move the college in the next 5 to 6 years. If I can make the slides go forward. All right, so I just thought I would start with making a land acknowledgement. Among things that have changed in my time here, we didn't actually have a land acknowledgement statement when I got here. I'm going to talk a lot about community, and I think one of the important aspects of community is it includes those who came before us, those who are here now, and those are going to be here in the future who we're bringing into our space and our work and our community, all of us. So I think it's important to acknowledge that we're on land that originally belonged to Indigenous people. And I had the privilege of meeting one of our graduates during the middle of COVID as we were doing vaccine outreach, Helen Dancer, who many of you may know. You may not know that Helen is a Kentucky Indigenous person. She introduced me to that community as we were building the outreach efforts from the college for vaccine education. And that's been a really eye-opening experience. I encourage you, if you're not familiar with the fate of Indigenous peoples in the state, to find some and ask. It's important to understand just what happened and the role we played in that and the benefit we've had in the state from all this wonderful land that we all collectively live on. So I want to honor those who came before us, their culture, acknowledge that their descendants are still here with us and are within our own community as pharmacists and healthcare professionals. I will make the slides work one of these days. So I also want to start, as I usually do, by thanking everyone in the college for making the difference you make every day by working hard at our collective missions, making sure that we get done what needs to get done and we do it well and in an embracing way. And I'll sprinkle a few quotations through this year. I chose our poet laureate. I'll let you read that as I'm standing here for a second. It's not only that we do things well, but that we do them with kindness in our heart. And we collectively believe in the importance of coupling those two. I also like to go over my own principles of work every year. I hope these can serve as an example for everyone in the community. That we pursue our work at the highest quality, that we minimize our barriers for collaboration with one another, because it's as a team that we do our best work. That we make our decisions based on evidence and we change them when we need to as that evidence changes. And the last 2 years have been a real lesson in the importance of that. That we share not only the ownership and the credit, but also the blame when things, as they inevitably do, go sideways. And that we don't forget to enjoy life. I'm conscious of how easy it is as a CEO to say, balance your work and your life and have an enjoyable life, pay attention to the good parts. So I, every year, remind you, I actually do take a vacation This is me kayaking off of Sanibel Island in July. During the 2-week period, you probably couldn't get me on my cell phone. And I will say to each of you, if I can manage to squeeze that out, so can you, and you should, because those times with your family and your friends outside of this building are what keep you energized when you're here. So our core missions remain as they always have been: education, practice, and research. And those are underlaid by our community. We do everything in the context of community. We all belong in that community. And we work best when we welcome everyone to us. So I'll go through each of those pillar areas in a little bit. I've started each section with a slide where I'm just going to highlight a few of what I think are some of the real wins we've had in those areas. I won't necessarily read through all of these. And the person who's responsible for leadership in that area in the college. So I do just want to really give a shout out, and I'm going to give a few more of these, to everyone for slogging through everything the world has thrown at us the last couple of years. We're not done yet. It's been a real hard walk. Someone who was reviewing these slides told me people won't know what slog means. If that's true, it's your vocabulary word for the day. We've gotten a lot done in this period, as I'm going to go over in the next couple of slides, including winning one of the university teaching awards. So if we just look at the epidemic itself, what did we do here at an overview level that worked? We pivoted our curriculum into multiple modes, got that out to a steady state and made it work. And so that included face-to-face hybrid work like this talk. We're all still getting used to having part of your audience in front of you and part of you electronically, and fully remote work. This is particularly hard in the experiential areas where we literally had to work with hundreds of distal sites, all of whom had slightly different views on what was going on and what needed to be happen. And educationally, we got through this in a way that had no significant disruptions that impacted in the long term, and no delays in people graduating or getting out into their jobs. And I just want to pause and have you think how important that was to every student who was in this building and transiting through this building, how hard it was to make that happen, and how much individual work each of us had to bring into getting that to go. So this was an achievement that you should all be proud of, and that you're still rolling forward on today. I was just talking with some people this morning. Is this wave over? Are we going to have another variant next week? We still don't know. We know we've got some more time to get through this, and we'll do that the way we did it. We'll make it work. We'll do it together, and we'll prop one another up when we need to. At the same time this happened, we know that this negatively impacted the experience of many of our students. They've struggled more academically in the last couple of years than they have in the history I've had this job. I think really the experience of any of us as instructors. And we're going to see that continue to play out, because those students who were in high school 2 years ago, who were in college 2 years ago, all are going to carry the impact of that disruption with them as they move through our halls to become professional pharmacists or pharmaceutical researchers. And it's not just us, this is playing out nationwide. All the pharmacy schools, really all of the schools, are seeing the same kind of issues playing out. So what did we learn? Should we learn from this? I think there were really 3 big lessons that are important to keep in our heads going forward, hopefully to something that's a little less disrupted shortly. The first of these is, institutionally, we are much more agile than we think we are. We collectively pivoted in 2 days to deliver a curriculum to everybody effectively. If you'd ask, I think, any of us before that happened, if we were capable organizationally of shifting everything we did collectively on that time scale, we all would have said no. We would have had varying degrees of no. We would have thought it would have taken 2 weeks, 2 months, or we never could have done it, but nobody would have believed we could do it in 2 days. but we did. So let's hope that we don't ever need to pivot that quickly, that massively again. But remember that we are capable of doing that and doing it effectively and doing it well as a team, so that when we find things that we care about, that we want to implement, we never say to ourselves, we cannot make that change because it's too big, or we have never done it before. I think that's a huge lesson that we collectively learned. It gives us the power to move what this college does to the place that we want it to be, if we have commonality in mission and buy-in from the team. On a lower level, I think we also learned we can use a variety of different technologies other than just face-to-face to effectively deliver our missions. And we now have the possibility of really looking at each portion of what we do and asking ourselves, what is the best way to do this? So just before this, we were having the executive council meeting. We were talking about whether or not travel is going to pick back up. One of the things I've decided is I don't need to travel to have a 2-hour meeting for most things. But I was doing that before the pandemic. I would get on a plane to go have a face-to-face meeting because it was perceived as being important. And I think we're all going to find places in our lives where we can make those shifts. I think the third thing is something that we had talked a lot about, but never really embraced, which is that we need to be in better touch with our students. They need our attention, they need our individualized attention, and we need to be willing to work with them in order to make their educational experience as much as it can be for them. We've spoken those words, we've had it built into our philosophy. This epidemic forced us to do it because as many people responded to the stresses of their individual lives, things got very acute and couldn't be ignored. But I want us to remember, it doesn't have to be an acute emergency to deserve that individualized touch. And we've all learned how to balance it when we're balancing emergencies, which means we're capable of extending it in non-emergencies. So how are things going at the Uber level, thinking about the PharmD class and filling the room? So the enrollment management group had to pivot, like most of us, to doing things online. This is just to give you an idea of what they did in the last year to recruit this year's class. Despite the fact that the number of total applicants nationally has shrunk by 1/3, we are still 70% to filling next year's class with great students. So we are really thriving in what has become an incredibly competitive environment for delivering this education to students who want to be practicing pharmacists. And we've done that in a way that's continued to maintain the gender diversity of that class and continue to develop other types of diversity within our student body over time. And what we've really done is used our relational recruiting methodology to focus on retaining our traditional students who are from Kentucky, recruiting those from out of state, and diversifying in both of those pools to include people who weren't necessarily well represented in our student body before. One of the key things that has emerged from this is, in this increasingly competitive landscape, the cost of what we deliver is now counterbalancing the quality of what we deliver. Students are making really hard-nosed decisions about cost versus reward in choosing where to go to school. And one way for us to address that is to provide better scholarship support for students who wouldn't otherwise be able to join us. And this has now become our major fundraising goal for the next couple of years. So that's a learning coming out of dealing with the pandemic and dealing with the overall environment in pharmacy. Now, a big win, when I walked in the door, we had a plan for Curriculum 2020, and we were starting to implement it. And I'll remind you that this applied active learning principles to a triad of goals, teaching foundational concepts about current therapeutics and about the future of practice all together, so that a student emerged from this prepared for a life of having to relearn every day as practice shifts. The class of 2022 will be the third cohort to go through this complete curriculum. So we got this done, got it done in a really good way. By all evidence we have available, it's having a positive impact on the students. And it's largely at a steady state now. So the things that are still going on with this that still need a little attention, we're still tweaking exactly how many hours are in which class, exactly what order they're in, and details like, do we buy into pass fail or letter grade schema as best ways of evaluating how students are doing. I think we all know we've had a lot of turnover in the faculty in the last few years, and we're going to continue to struggle with that for the next couple of years to come as we have people retiring and they need to be replaced. And this has caused some shortages, a lot of shuffling, and sometimes worries about expertise deficits, but we'll get through this. And we're doing it in a way that has really moved us towards recruiting our faculty holistically, just like we switched to doing that for student recruitment 7 or 8 years ago. I think in the long run, what that's going to give us is a much more vibrant and agile faculty to enable us to continue to excel as what I hope will be the preeminent or eminent College of Pharmacy in the US. Part of this tuning has been to add ResCats and career cats, which I'll come back to in a minute, aimed at increasing student success after graduation. So if we look at qualitative metrics for the college, here spread across 5 years in a colorblind friendly color scheme, and spread across other top 6 colleges in the US, next to the national average over on the right. So board pass rates, we always are in the 90-ish to 95-ish % first pass rate, and that's been consistent the whole time. I have these statistics available and also consistent with our comparator schools. To give you an idea about what that means practically, our students in the bottom quartile outperform the top quartile nationally. So we quantitatively deliver a better chance of passing licensure exams, walking out our doors, than the vast majority of schools do in the US. And that's congruent with our ranking nationally, and it's been maintained in this year, like every year, is looking good. We also do well in our match rates for those students who choose to go on to postgraduate residency training. Again, the same layout of schools, same time frame to look at and compare to the national average. So you can see that, again, we outperform the majority of schools in the whole pool very consistently. We're also in track with our comparator schools in the top 10 ranked pharmacy schools. But this was identified as an area that we could improve performance on by helping students to realize exactly what they could do to pick the best residency option for them, and exactly how to prepare for all the choices they had available, which was most attractive to them, and which they could prep themselves best for their initial postgraduate experience. That's where ResCats and career cats respectively come in to give our students another step up in being prepared to be competitive and excel in their career development early, walking out of the UK College of Pharmacy. And I hope it's not a data variance issue, but you can see that in 2021, we popped up well above 80% after we've implemented more focus on individualized career choice and prep for students going into postgraduate education and into their early careers. And I hope we will continue to see that go up, and that we're going to hit match rates that are as high as possible for people going through our school, because that'll tell us not only we train them well, but we help them make the best match choice for themselves in order to enable where they want to go long term. So in terms of the graduate program, we have redesigned the program and then begun to re-implement that program. We're now 2 years into the newly designed PhD program, which is in a much more modular framework, much more uniform education for the students, and a much more student-centric focus. Again, coming back to that idea of enabling individual growth. This, I think, also is a huge achievement for the faculty to have gone from a theory to a plan to executing that plan in a creative way to deliver education for our other major pool of students. And I'll end this section just by framing for you what we collectively agreed to in the strategic plan within our educational arena. So one portion of this was to continue to refine and strengthen our core offerings, the PharmD and the PhD in particular, and also to tune the dual degrees to be the best value and the most useful for students. We also committed to exploring, not necessarily to implementing, but to exploring other educational offerings like an honors PharmD, a bachelor's in pharmaceutical sciences, and a potential for online master's programs where they make sense. So we'll be working through that process in the next 5 years, making just as intentional decisions. And I'm confident if we move forward with any of these, we'll be as successful as we were with the new PhD and PharmD programs. And we've also committed across the board to a more deeply connected student-centric approach to working that includes reaching out further to student pools to bring the right people in, and partnerships external to the college to strengthen our ability to deliver for individual groups of students. I want to move a little more and talk about practice. This has been an area we've been actively working on expanding, and particularly working on expanding within the community practice setting to complement the very strong offerings in hospital systems. So during the time, as I'll go through these slides, we've expanded both education, postgraduate education, and practice advancement. So looking at residency offerings in the last 6 years, we've added 6 new affiliated programs, a total of 17 positions. I've articulated my vision, which is that by the time we're done with this, our community affiliate residency program is the same scope as our hospital program, largely across the street. This has brought us up to 14 affiliated residency programs and 60 affiliated residents in steady state. Just one path through thinking about practice advancement. What has the college done in leading advancement within Kentucky? So this is a timeline talking mostly about board approved protocols and how those have impacted. So you can see from a starting push for legislation to allow for advanced practice under board approved protocols, which was passed and implemented, a focus on removing barriers for things like opioid use disorder, one of the early protocols, naloxone dispensing, to be implemented, and continue to expand the scope of practice that was covered by protocols, while also expanding the practicality of using those protocols for the majority of our constituents, whatever their practice setting might be. The key cap for this, that's an intentional pun, by the way, was the pharmacist payment legislation that went through last year, which enabled pharmacists to receive the same compensation for carrying out advanced practice that any other practitioner would. And this couples the ability to not only deliver that practice, but to get compensated for it, which was a key barrier to community implementation of these kinds of advanced practices. So about 2020, I think Brooke started just as the epidemic broke. We hired our first chief practice officer and charged her with organizing and leading these efforts in order to continue to expand the college's impact in this area. And as part of that program, last year, we added a practice implementation pharmacist who's been charged with interacting with that payment services legislation and enabling community practitioners to develop business models they can implement that will push forward their ability to deliver advanced practice wherever they may work, whether it's an independent practice, a small chain, a large chain, or a hospital. So this, I think, is the way we lead. We figure out where the problems are. We find practical solutions to those problems. We get everybody at the table who needs to be there to implement them, and we drive them forward. So we always leave Medicare Part B provider status on the right edge of this arrow. It's been there the entire time I've been a pharmacy professor. So I hope before I retire, it will be gone as something that we've knocked off. But I will just ask you to think about what's next here that we can do today to continue to move practice forward. So one thing we've really been focusing on is working through community networks. Things like CAPNet, a research-oriented network, Flip the Pharmacy, CPSN, networks that are oriented towards improving advanced practice in the community settings. And we're doing this at a regional level within the state, where we're interacting with pharmacies geographically and practice site as broadly as possible. Trish always likes to remind me there's only one county in the state that doesn't currently have an open pharmacy, Robertson, which is in the red on the state map on the right. And I just wanted to give you one example of this. I remember when I interviewed for this job, I put up a pipe dream of running clinical trials through community pharmacies as one of my 3 pipe dreams coming into the door. So I was quite happy when this Protects project got put together, which was a pilot to look at doing COVID screening and microepidemiology within the community pharmacy setting across the state. And went through all the barriers. Pharmacists can't do that. Nobody will pay for this. It won't work practically, to actually start to implement this work going forward. So in a pilot and in a larger expansion phase, we should be positioned to be able to do this. Now, I wish we didn't still need to do COVID surveillance, but I am sorry to say we're probably got another couple of years of work to get this off the ground as a proof of concept that we can do clinical research in community pharmacies. So not only advanced practice at the bench, in the bed, but connect the two together. Last piece of this I really wanted to talk about, many people on the call or in the room have been involved in, which is vaccine outreach, both in terms of administration and education about vaccines. So I show again this network map where we're looking at constituents and implementation. And we've really tried to keep this as broad as possible and to keep the college in the role of acting as a nucleus of collaboration and interaction in order to deliver what is needed to get over the COVID crisis, but also in the long term to reuse what we learned there for other states like flu, other types of vaccination. So this includes the local community at UK, communities of color and the indigenous community in the state, the Lexington and regional community, and in some pilot work, larger outreach, collaborating with ag, extension system, and other partners statewide to be able to deliver content and physical vaccination. And doing that really through any channel that's available. So many of you have participated in town halls, done media outreach, helped write brochures that were available or tune those to individual patient populations who needed them. And this has been consistently supported by the college at a logistical level, originally through Operation Immunization and now through the Vaccine Reserve Corps. We intend to continue doing this and hopefully to expand scope. I just saw some great data about the impact of the flu mandate in 2020 versus this year in terms of uptake of vaccination. And I think we have a really good argument to make to the university that we should dig in and offer free vaccination to every student who wants it, that it'll increase uptake and decrease disease. So in terms of thinking about strategy, what have we committed to in the strategic plan? Engaging. So to continue to engage with the legislation, to engage with our pharmacists in our immediate community, but also to engage with other practitioners. How can we work together across disciplinary boundaries in order to deliver the highest quality care to the largest number of people who need that care? To continue to educate outside the college by supporting and enabling lifelong learning, whatever that means for the people who need it. So what's the difference between offering a continuing education hour at a meeting and teaching somebody who graduated in 1974 how to vaccinate? Or helping them set up an EMR and a billing system in their pharmacy so that they're able to get paid to vaccinate, which means they'll do it. These are the kinds of engagement that we need to build so that we can continue to offer that support to move practice forward everywhere and in every setting. And to continue to remain focused on transforming practice itself. So not just implementing what we know we can do today, but asking ourselves, what can we do tomorrow? What can we do in 10 years? What is worth this level of engagement to deliver to our community, whether that's our pharmacy community or our global community in general? The next piece I wanted to talk about was research. This is just an annual look at publications and grant funding in the last fiscal year to give you an idea that we've continued at a good pace in both of these. And thanks to Chris Stelcher for, at the last minute, actually calculating an H-index for the entire college to give you an idea that in aggregate, we are equivalent to a nationally prominent researcher, which is saying something, that your median is up at the nationally prominent level in a collective index. And I'll show you where we're doing in terms of some of the other metrics. So before I get into thinking about how we're doing, I wanted to comment a little on what we're doing. And this is two views of that. One of which is looking at research subject areas. It's sort of a dictionary viewpoint. And the other looking at a word graph based on the titles of the papers that we publish. So two different ways of thinking about things. Where does your work categorize out in the hierarchy that people usually use? And you can see some real strengths and some growth areas for us have been substance use disorders, improving therapeutic interventions, and infectious disease, together with a continued strong output in natural products research, both at the basic and translational level. If you look at the words that show up in our titles, it's nice to see that patients and use show up right smack in the middle and large. But if you want to pick your favorite area, I'll guarantee you can find it on that UK. We hit drugs, we hit cancer, we hit pain, substance use disorders. We hit health in general, we hit individual targets. We cover the whole spectrum of what normally would be done in pharmaceutical research. Dave's trying to squint to find T-cell activation, or it's in there somewhere. How are we doing collectively? This is two, in my mind, still fairly imperfect measures for measuring research output. So I like to focus on our aggregate grant funding relative to our faculty, which is to say how much we leverage the expertise we have in the building to bring in extramural funding. And yet again, in 2020, we come out as #2 nationally in terms of dollars raised per faculty member in regular, special, and clinical title tracks. That's pretty remarkable. Not unexpected, but pretty remarkable. Same set of comparator schools, so the top 6 schools in the US News and World Reports. And you can see in that set that we do really well across all of our comparators, except for UCSF, who's sort of in a totally different ballgame from everyone else. So overall, this has been consistently good. We've been increasing these metrics in general the last 5 years. When Dr. Talbert chose to move from our halls to the halls of medicine last year, we took a big hit in state contract revenue. So we did drop for this fiscal year, but John's been really worried about this. So John, I put that bottom line in for you, just to let you know that we're still #2 in overall research revenue per PI, even without Jeff's contracts built in. So this means we consistently do a good job at raising money to enable our science. I did want to make one less positive comment about that, which is if you dig into these numbers, half of this is driven by 4 of us as PIs. So something we're going to be focusing on in the next 5 years is to raise the average funding across all research active faculty, the Moneyball strategy if you're a baseball fan, so that we're getting more hits on base going forward. And I think that is the way to continue performing at this level and indeed to raise it up. We look on the other side. I didn't want to get into H factors and indices and talk about competitive ability that way. Instead, I chose to take a stack plot here and really look at the impact our papers have. So the way this is written out, there's a publication year, which is color-coded, so 2016 is pink. As you move from left to right, it's the number of citations for the papers that were published in that year. And there are a couple of things I want to point out that are relatively unusual. The first of which you can see in the progression of the pink graph, which is that whatever was published in that year hit 800 or 900 citations per year the next year, and then maintain that citation level over a 5-year time. It's much more typical to see an up and a down kind of trend. This is a very consistent property of the way that we publish, which is to say we tend in aggregate to do work that has long-term impact, that people come back to and cite over time, not just because it was popular this year. And you can see that trend play out. And in an average year, we're generating 1,000 citations or so for the work that we collectively publish. So this is a pretty good level of impact. Measure the level of who will cite us. Now, most years, I give you my favorite 2 papers, which have absolutely no underpinning other than I enjoyed them. This year, I did something a little different. So we went back, thanks to Chris and John and the research librarians for helping with this. Looked at all the citations for all the papers that were published in the last 5 years, pulled out the highly cited papers, and then asked that it be a primary research article, and that one of our faculty be either the corresponding author, a corresponding author, a first author, or cited in the author contributions portion as having a high impact for design, implementation, and analysis of the work. So these are papers where our people did the work that were highly cited. So I wanted to get an idea of what does the world see as our most important contributions in research and scholarship. So the first of these, I want to, and these are in no order. I actually randomized them the last time I went through the talk just to make sure they weren't in any order. Has to do with whether or not a pharmacist will use the board-approved protocols and the physician-approved protocols that allow them to dispense naloxone, an opioid antidote for overdose, to patients. And what you can see just by looking at the plots here is that in most settings, about half to a third of pharmacists are willing to dispense. And if you ask them to do it themselves and to initiate that themselves and to proactively define who might need it, their willingness to do that goes down. So even though they're legally able to do this practice, it's proven to be impactful on the patients. Somewhere between half and 2/3 of pharmacists aren't willing to start the process of dispensing this antidote for overdose. So I think this really highlights a key question and a key focus for us going forward. Why is that the case? What is it about doing this that makes it not happen? Are people afraid? Do they feel like they're enabling an addict? Is it too much time or not enough compensation? There are all kinds of reasons. And given a community with a large viewpoint variance and a large economic variance, practice, all kinds of legitimate reasons, this will never be 100%. But this really highlights the critical role that the pharmacist plays in acting on this ability to practice and raises some issues about how we can improve participation going forward. So another one, actually was one of my favorites one year, and then it came back up in the citation list. So paper out of Bjorn Bauer's lab, looking at what happens during a seizure to your tight junctions and how that impacts disease progression. So the key finding here really is seizures themselves induce degradation of tight junctions through matrix metalloproteases. That feeds back by making it more probable that that patient will have another seizure. So there's a feed forward loop driving increased disease severity. And I think it's this physiologic level of understanding that gives us some ability to go in and look and say, what is the right way to intervene here? Where is the place that's rate limiting and controlling this loop? What is the physiological control element And how can we do a better job of anticipating probability of having a seizure and intervening in that seizure? Another personal favorite, which as you can see from the background made CNN, work out of Chris Delcher's lab on the association between recreational cannabis legalization and opioid deaths. I wish Chris had 5 more years of data for this paper, because the really cool finding was we had a constant slope uptick in opioid deaths, starting in the early 2000s and moving up. When cannabis was legalized for recreational use, that slope flipped. It started to go back down, and by the end of 2 years, had gone down 3%. And it's really tempting to think that that will continue and might actually reverse this process. And of course, we don't know because we don't have the data. So I will just enjoy the thought that that might happen. I also like the Kentucky connection to this. Anybody know what the leading agricultural crop prior to tobacco was? Hemp. We are uniquely positioned nationally to be able to outcompete just about everyone in growing marijuana, if only it were legal to do so and we had a local market. Anyway, I'll leave that for people to interpret how they wish. So what I have to say, I was surprised to see in the mix at first, and then I thought, no, I really am not. We do a lot of really creative things in the classroom here. Jeff Kane in particular is really good about publishing them. So here's a study looking at using escape rooms, which were thought to be a way to increase engagement by forcing someone to combine their foundational knowledge, analysis of an emergent problem, and their problem solving skills. So all that had to come together. And then that would give you that engagement in the class. Jeff showed that indeed, when asked to do this, students find an increased sense of engagement with the material. So here's a creative, active learning approach that's a little more fun than listening to somebody like me blathering on with a PowerPoint. It can move forward. And these are all embedded throughout our curriculum. There are ways we're changing the way we deliver pharmacy education. Now, one of the reasons I highlighted this one is I want to encourage all of you to publish more about how you teach. We do a lot of really creative things here that should be nationally leading. We do a fairly good job of getting those out in the literature, but we could do a lot more than we do. And I really want to encourage you to double down on what you're doing in the classroom to get it out there for everybody else to consume. The last of these has to do with infectious diseases at a Sylvie's lab. This is looking at a older class of antifungal drugs, azoles, and pivoting them. So these are sterile demethylase inhibitors, a fairly general but not completely broad spectrum. How do we get them more potent? How do we get them broader spectrum? Many people would not have even turned back to these because of the sense that we had played them all out in the 80s and 90s. But Sylvie was able to find ways to increase spectrum and potency and actually decrease side effects to make them positioned to be safer drugs in general use for azoles. So I'll leave you with this as a way of using your very fundamental work to pivot towards improving clinical practice. So this slide will probably make you realize why I chose the examples I did. So what have we committed to doing in the research space? So I think one of the key things is to maintain and grow our foundational areas. So we don't want to abandon any of the strengths that we have right now. We want to continue to shore them up, to bring in people who do exciting work in each of the areas we're historically strong in. We also want to use the interaction of those areas to translate more broadly and more impactfully to new and improved treatments. And we want to do that through integrating by connecting clinical and preclinical research, not only from bench to bedside, but from bedside back to bench. What are the most critical problems to work on? Because we can't treat those problems now. How well do the drugs we have work? How does that inform what science we need to do in order to make an existing drug work better or identify a place where we need a new one? It's that connectivity and that connected to the translation that will position us to be nationally leading, even more so in research. I want to spend the last bit talking about community. So I think the things we've really done through focusing on community have been to increase connection internally and externally, start to build frameworks to understand what our community is, who have specific needs amongst us, and deliberately increase our diversity. So currently, if we look at our community, we're about 60 line faculty members, about 60 staff, about 750 voluntary faculty. So when I got here in 2016, that number was around 500, a little under 500. I want you to understand how much leverage that means we have pulled by connecting out to the pharmacy community to be able to deliver on our educational goals. About 6,500, 6,700 living alumni and friends in that pool. If we look at our student bodies, about 540 PharmD students, about 400 of whom are from Kentucky, about 80 of whom are first-gen students. The graduate student pool, much smaller, a lot of potential for growth there, about 60 and a total of about 22 postdocs. So built into our strategic plan is maintaining the PharmD class and continuing to grow in other areas, potentially through building new degree offerings. Now, thinking about this on 3 axes, first, diversity. What have we done to enhance diversity here? We've built training paradigms about recruiting historically underrepresented groups, and we've been successful in increasing historically underrepresented groups within our student body. We've launched informational landing pads like the DEI webpage. We built in the Dean's Seminar Series to bring in speakers who we had not seen before, and particularly to address disparity and issues of diversity in health. We're working on increasing historically underrepresented groups within staff and faculty, particularly by focusing on building equitable hiring practices. And I really want to give a shout out to those who are participating in the faculty searches that are going on right now. That has been working really well due to everyone digging in to make sure we took a collective look at getting the broadest possible group of people in the door as candidates. We're starting to build process to measure what we're doing and the impact that that has. Because remember, I said at the beginning, we want to base our decisions on evidence. So we want to be able to prove to ourselves that these efforts are improving our outcomes. And we've started to use the greater community to build relationships with institutions like historically Black colleges and universities and other minority serving institutions that can help to pull in students we don't normally see. We put a lot of focus on working equitably. Within the college, we've increased structure to have people who focus on improving equity and diversity and who have staff support that they need. We've worked to pull in staff as a participating part of our governance structure. And we're in the process of doing that with students and other groups. And we've increased support for people who want to engage in community activism. So we want to enable the voice of the people who are within our community, because it's through that range of voices and hearing them and debating with one another that we learn and we improve. And we'll continue to do that, especially by focusing on the local community. So the last piece of this I wanted to focus on was inclusivity. This is probably the place we've had the most visible changes. So as we approved the strategic plan, we added community inclusion into our mission statement. We built and approved a values statement for the first time, which heavily relied on these concepts in the way we were defining our community. We've gone through 2 processes of looking at our course offerings to understand what we're doing to understand inclusion within what we're teaching. We've added that as a component to course review when the curriculum committee looks at courses, and we've started to work at the individual course level with instructors to increase DEI incorporation where appropriate into our coursework. We're continuing to expand the training that's available to everybody for things like unconscious bias, cultural humility, and how to mitigate harm through being non-inclusive. And we'll continue to work in those areas. The next big foci for me are bringing community and student voices into our governance, really working with each of the areas I've talked about to make sure that what I'd like is when I leave this role, DEI is not a separate thing. That we weave it in to everything that we do so that we're always thinking about being equitable and inclusive, whatever we're working on. It's not something extra, it's just part of how we are. And as I said, we're building systems to monitor what we do and the effects of that monitoring. So in terms of community, the things that we committed to doing, the first was really continuing to nurture inclusivity. So as I mentioned, we built a values statement. We've added and will continue to add structural support within the college. And we've agreed to the concept of adding a second language to our language base. So we're going to be trying to figure out how to have more Spanish involved throughout the college. We've agreed to connecting within to our small community, alumni, students, staff, and those who will be with us. Everyone who is in this building has lived in this building or the 4 other buildings that were this college at the university. I have to say an ironic win for COVID has been the process of moving to hybrid meetings has meant a lot more alumni engagement from people who wouldn't travel to come to a reunion or travel to come to an event, but who can participate on Zoom. And so we'll be continuing to utilize that technology in order to enhance community connection. We're also committing to connecting outside more impactfully and intentionally. So things like community collaborations, education partnerships, and externships being worked into what we're doing within the college. Now, I wanted to give you, as I'm ending, just a reminder that we really hit every state and any major area with any level of population within the United States in our alumni pool. This is a visual representation of that. That's also every county in the state and about 6,500 to 6,700 people we're in contact with who are within our sphere. So this is a massively leverageable connectivity. And as I'm leaving this slide, I would just encourage each of you to spend a little time thinking about how you can help and what you can benefit from this connection. So I'm not going to go through the finances in any detail. I just wanted to say as I'm ending, we're still fiscally sound, despite budget reductions, despite COVID, despite everything that has happened. We're going to be able to move forward with the strategic plan that we put in place. You're seeing that playing out now as we're doing faculty hiring, and you'll continue to see that playing out. And we will continue to be paying very close attention to money and asking you to raise money and be prudent in spending that money in the places that are going to have the biggest impact. The last piece I will talk about very briefly is just to leave up, for those of you who've forgotten them, the value statements that we agreed to. A couple of these I want to highlight. So encouraging diversity of thought and speech, to me, have always been really core to functional positive change. Being inclusive means everyone's included. The people we disagree with, even more importantly, than the people we agree with. And in our community that's dedicated to moving forward barriers, advancing practice and research and scholarship, that discourse is really important. We need a safe space for everyone to be and to speak, and we need to exercise that speech in ways that challenge one another productively and help us collectively move forward. I also want to emphasize we have to steward our resources, our time, our effort, and our money to get things to work. Got 5 minutes. And I wanted to leave you with one thing. We're going to have a challenge. Frank and I learned this week that we're going to have the comprehensive accreditation visit October of 2023 for our 2024 reaccreditation. So despite our collective ignoring of the process we're going to have to go through to get reaccredited, it is coming, and we will be rolling that out in the next month or so, identifying a leader and starting to work on the self-study. So this will be coming and taking a lot of our time and effort going forward. But as you can probably guess from what I've said before this, I'm pretty confident we're going to do well and emerge from this with full reaccreditation. And I'll leave you with my favorite Lee Iacocca quote, which has been embodied in the last 2 years. And take any questions or thoughts for the last couple of minutes.